This is Michigan Moments, rediscovering the pioneering moments of the Great Lakes State.
At the turn of the 20th century, sanitariums were central to Michigan's public health strategy. These institutions weren't just hospitals. They were where people went to heal from chronic illness, to breathe clean northern air, and to isolate from the spread of tuberculosis and other infectious diseases. Buildings like the Mercy Sanitarium in Manistee reflected the seriousness of that mission. Brick and stone fortresses, often operated by religious orders, provided rest and treatment for the sick and dying. The towering steeple and arched entry spoke to a faith in medicine and in God. In Flint, Oak Grove Sanitarium took on a different tone. Built in a castle-like style with conical towers and dormer windows, it looked more like a private academy than a hospital. But for patients with tuberculosis or other long-term ailments, it was often the last place they'd ever see. Howard City's sanitarium operated on a smaller scale, but its round turret and wide porches spoke to a similar purpose: rest, sunlight, and separation. These were the three pillars of sanatorium care before antibiotics changed everything. Some buildings, like the Lee Sanitarium in Dowagiac, blended into residential neighborhoods. Modeled in a Tudor Revival style, they masked illness behind architectural charm. Others, like the Northern Sanitarium in Gaylord, represented a new phase. Large, institutional, and built in the mid-century modern style, these sprawling complexes were part of state-run efforts to centralize treatment for everything from tuberculosis to mental illness. In White Cloud, the Rayonized Sanitarium stood out for its unique signage and reformist roots. It was likely part of the naturopathic health movement, offering dietary regimens, hydrotherapy, and rest cures as alternatives to conventional medicine. Power, Michigan hosted one of the Upper Peninsula's lesser-known facilities. Remote and self-contained, it provided critical care in a region underserved by major hospitals. In tiny Smyrna, an unassuming white building bore the name Sanitarium. It looked more like a boarding house than a hospital. Yet inside, it carried out the same mission, isolating the sick, giving them space to rest, and hoping nature would do the rest. St. Louis, Michigan, once known for its mineral baths, also hosted a facility simply called the Sanitarium. With wide porches and multiple floors, it spoke to a time when fresh air and quiet were considered medical treatments. These buildings dot Michigan's history, each a chapter in the story of how a state battled disease before modern medicine. Most are gone now, razed, repurposed, or left to collapse. But their memory endures, in photographs and patient records, in family stories and forgotten archives. They remind us of a time when rest was medicine, when air and light were prescriptions, when communities built these facilities not out of profit, but out of fear, compassion, and a desperate need to heal.
This has been Michigan Moments, offering bite-sized morsels of Michigan history.